Well, hello again, everybody. It's still March the 8th, 2023. This is Dr. Ted, and once again, welcome back. We just did one on sore throats, and hopefully you look at that. So we're going to do one now on mononucleosis. Mono. Everybody talks about mono, right? There's a lot of myths about mono. First of all, people say, well, what is mono? How do you catch it? Can you come back again? You'll see adults. So I saw people all the time come in as adults and they'll say, well, I had mono as a kid, but I think it's back again. I think I got mono again. And so we'll talk about all this, okay? So first of all, let's talk about your blood. We've all had blood drawn in a test tube, right? They come in, they put a needle in your arm, they draw blood, and you get a test tube of blood. It's all red, right? It's red. But if you take that test tube and you put it in a little rack vertically like this and let it sit, all the blood cells, the red blood cells, will sink to the bottom. And then you'll have that yellow plasma looking stuff on top of that. And at the very top, you'll have a little layer called the buffy coat. I don't know who invented that name, but it's a little layer, and that's your white blood cells. Okay, so let me just show you a picture. This is so interesting. So here we have, this is your blood. If you this guy's blood's been sitting there for an hour, right? So you draw their blood. What used to be all red has now, let me get my pointer here. What used to be all red has now, the red blood cells are heavier and they sink to the bottom. Just like muddy water, if you let it sit long enough, the mud will sink to the bottom and you'll have clear water on the top. With blood in our bloodstream, 45% of the blood is red blood cells, and it's all dark when it sinks to the bottom, or not darker anyway. And this little plasma looking stuff, this is that straw colored fluid. Guess what else it looks like? It looks like olive oil. Think about that for a little bit, right? 55% of our blood, more than half of our blood looks like olive oil, right? What if you took this part of your blood and spread it all over your body? What would it look like? Especially at night, and maybe you had torches for light, not regular lighting like we all have. Torches for light and that all over your body. It would look like sweat. That's kind of interesting, huh? That this olive oil looking stuff looks like sweat if you put it all over your body. Most of your blood is actually this plasma. Then look at this. There's our buffy coat, and it's right here, right between these layers. These are your, like it says right there, white blood cells. Those are your white blood cells. Those are the ones that fight infection, okay? So white blood cells, they are the infection-fighting cells, and they also do other things. They're kind of the immune system of your body. And there's different kinds of white blood cells, okay? So look at this. We're just going to shorten it to WBCs, white blood cells. When you get your blood, if you go look on your medical charts on the computer, you'll see they have one thing called the WBCs. That's your white blood cells. And look at the different kinds. And I always tell people, my patients, I say, think of it, it's like you have the Jones family, right? And you have Mom, Dad, Bobby, Susie, Tommy. They're all members of the same family, but they're clearly different. They live in the same home. They eat dinner together. They go on vacation together. So they're similar things, but they're clearly different. Dad is a lot different than little Tommy, right? They're different size, different functions. Well, your body's white blood cells are the exact same thing. Neutrophils, they fight bacteria. So when you go to the hospital and we think you have a bacterial infection, we're going to draw blood and we're going to look for your white blood cells. Number one, are they higher than normal? Are you making lots of infection fighting cells? Is your body cranking them out? And which kind are elevated? If you have high neutrophils, that's probably a bacteria. Pneumonia, bacteria in your blood. Another one, lymphocytes. Lymphocytes fight viruses. So if you come in and you have a cold and we draw blood, most likely your lymphocytes will be higher. And you've heard of lymphoma and lymphocytic leukemia. That means your lymphocytes are sky high, way astronomically too many. And they're not that great of white blood cells either. So bacteria, viruses, eosinophils, they go up if you have a parasite, or allergies. Eosinophils go up. And there's a bunch of other things. Look at this other one at the bottom, monocytes. There's a type of white blood cell called the monocyte. Cyte means cell, right there. Latin for cell. So monocyte. There's a type of white blood cell called a monocyte. When you get a virus that causes the white blood cells to go up, but the type of white blood cell that goes up is mostly monocytes or higher than it should be, we call that mono. What can cause mono? The most common one is Epstein-Barr virus, EBV. You've heard of that one. That's the big famous one. There's another one called CMV, cytomegalovirus, and there's one parasite that can cause mono, toxoplasmosis. It's a parasite that cats can carry in them. They always tell pregnant women, don't clean the litter box because cats in their waste can spread toxoplasmosis, and body's immune system is a little bit tapered when you're pregnant. There's the concern you might get toxoplasmosis. I've never seen it in a pregnant female. Doesn't mean it doesn't happen, but it's not like the most common thing. But any of those, so toxoplasmosis, cytomegalovirus, CMV, or EBV, Epstein-Barr virus, there's 3 causes of mono. We'll just talk about EBV, the most common one, Epstein-Barr virus. How is it spread? It is spread by saliva. That's how you spread monocytes. That's how you spread Epstein-Barr virus, EBV. So yes, kissing, yeah, you can get mono from kissing, Epstein-Barr virus. You can get it from kissing. That's the infamous way of getting it. But you can also get it if you share a drink and you get your saliva on a cup and somebody else gets it on theirs. Who tends to share drinks a lot? Kids, teenagers. I don't know why, and I don't know why maybe this is known, but you don't see mono in little kids very often. You know who you see mono in? Epstein-Barr virus? Teenagers. Almost all the cases of mono I ever diagnosed were teenagers, or somehow they got lucky enough and dodged it as a teenager. They may have gotten it in their 20s or 30s. That's really unusual. That's tough. It's hard. It's like saying, I never got a cold. Well, it's pretty tough to not get a cold, but every once in a while you'll see somebody that comes in and they have mono, and I'll talk about the symptoms, and you check them, and sure enough, they have mono, EBV, and you're like, I don't know how you dodged it as a teenager or in your early 20s, but yeah, you've got it. And we just look at their monocytes if they're elevated, okay? You can also get it, so saliva. So if somebody coughs on you or sneezes on you, right? Saliva is how you spread it. So yes, you can get it from kissing, but you can get it from 4 or 5 other different ways from saliva spread. What does mono look like? This is what mono looks like. Does that look familiar? That's the exact same picture I just showed you for strep throat. In fact, if you go do this, try this. Go Google mononucleosis and go to the pictures and you'll see this. Then go Google strep throat and go to the pictures and you'll see this exact same person. Same teeth, same tongue. It's the exact same picture. Let me tell you, mono can look like this. It can also look like, well, remember the one I showed you with all the little red dots? Anyway, I think I got rid of that. It could look just like strep throat. You can't honestly tell just by looking at the throat. They can have those little red dots. They can have that cream of mushroom soup coming out of it. It can look just like that. That can look like mono. So if you see a teenager with that, it could be strep. It could be mono. It could be CMV. It could be a dozen other things. It could be a different kind of strep, not the group A strep. It could be group B or C or D strep. There's all kinds of strep that can cause this exact same looking picture, okay? Mono, what's the big thing about mono that you're going to see? Again, teenagers and 20s, mostly teenagers, you're going to see 3 things. Symptoms. That's short, doctors. We don't like writing. We're lazy. Symptoms. Mono symptoms. Sore throat. You saw the picture. Abdominal pain and tired. Those are the symptoms of mono. You're going to have a horrible sore throat. You'll have achy, sore muscles and aches and pains. It looks just like the flu. Somebody with strep throat, somebody with mono, and somebody with the flu, they all look the same when they first come in. Then you look at their throat, and then you do blood tests, and you swab them, and you do different things, and you can determine which one it is. But they all look very much the same. Influenza, mono, and any of those kinds, and what was the other one? Strep throat, right? They all look the same. So we do tests to figure it out. Abdominal pain, right? Number 2. Why do you get abdominal pain? Because your spleen and your liver are going to help you fight mono and kill the virus and get rid of it. And that's what the whole problem with mono is. What's the treatment for mono? And this goes with the disease process, okay? The treatment for mono, there's 3 things I want you to remember. I wrote on my hand there, okay? And this got 3 things too. 1, 2, 3. 3 things for mono you remember. Rest, rest, rest. Okay? Specifically, here's what we're going to do. I told this to 1 million people over the years. How many of them do it? Hardly any. Almost none of them. Because they're teenagers. Good luck getting them to do this. Rest. You need more sleep. When you're asleep and you need to eat good and you need to eat healthy, but you need more sleep. What happens when you have mono? You're sick. You've got these little virus particles circulating through all your body, and you're creating antibodies, which is your immune response, that will coat the Epstein-Barr virus or the CMV or toxoplasmosis, and it will get in your liver on the right or your spleen on the left, and anything that's coated with antibodies gets taken out by your liver and your spleen. And that's how you fight it. That's how you fight mono. So your liver and your spleen and your immune system are all working together, and they're working overtime, so you get abdominal pain. Your liver hurts because it gets stretched. Your spleen hurts because it gets stretched. They don't like it. So very frequently teenagers will come in and say, I have this terrible sore throat, I've got abdominal pain, and I am just beat. So you'll say we do blood tests, or sometimes you can just look at them and determine it. But usually you got to do a blood test. If you don't check for monocytes, how do you know they have mono, right? You got to check their monocytes, which is a blood test. Sometimes you can they don't want their blood tested, fine. You likely have mono. But then you tell them, go home and go to bed early and sleep all night. Good luck with a teenager or a college student. Next one, rest from sports. Right? Because what happens if your liver, or even more, your spleen is large, and your spleen's really delicate, and you're playing football and you've got a large spleen and you get tackled and your spleen ruptures or breaks, it doesn't just break into one or two pieces, it shatters. It breaks into a dozen pieces and you can bleed to death. So people with mono, no sports. So you sleep more, rest from sports, and look at this one, rest from your usual schedule. Again, these are teenagers, college students, sometimes adults. Try and get them to slow down from their schedule. Sometimes your body's telling you, you need to lighten up and you need to rest, or we won't be able to mount a good immune response. And this is what I tell people. You don't have to. You're not going to die from mono. It's a virus. It's like a cold or a flu. Your body will fight it. You'll get better. But here's the problem. If you don't sleep enough and you don't rest enough and you keep burning both ends of the candle, working 3 jobs, and you don't rest and you don't eat good enough, your body's immune system will not mount a good immune response, and that mono will just hang on and on and on. And what normally might be a week or two of tired, abdominal pain, sore throat symptoms, fever, can go on for weeks or even months because you didn't give your body a chance to fight it. You didn't you didn't sleep more. You didn't rest from your schedule. You kept pushing it. And, you kind of can't blame them because people are busy. And that's what happens. And it hangs on. And the longer it hangs on, the more likely it is that you'll never make a great immune response, and it can come back later on. Here's one thing. This is kind of spooky, but I'll tell you anyway. Just like we said, there's the Jones family, mom, dad, 3 or 4 kids. You have the herpes virus family, okay? Herpes is not just the cold sore virus. That's one kind. Or it's not just the herpes you get down there. We all know that one. Doing things you shouldn't be doing. Chicken pox is a herpes virus. Epstein-Barr virus is a herpes virus. And CMV, cytomegalovirus, is a herpes virus. Plus cold sores, plus the genital herpes. What is the one thing herpes viruses all have in common? They're in the same family. So there's very similar things, but they're clearly different. There's, cold sores, not the same as mono. So there's different things. One thing about herpes family viruses, once you get them, you have them until you die. They're in you forever. You can never clear them out completely. Your immune system, if it does a really good job and mounts a good immune response, you can keep them under control, and they'll just kind of lie dormant, like a lecture I remember saying, it's like a bad hotel guest, a cold sore. He'll go into the hotel and he goes up to the top and he won't ever come down. And then every once in a while, he gets in the elevator and does come down and trashes the lobby of the hotel. Then before anybody can do anything, he gets in the hotel elevator and goes right back up and hides, and nobody can get him again. And to come down another time when nobody knows, nobody's expecting, there's no rhyme or reason or timing to it. It just randomly happens. That's why people get cold sores again and again and again. Some people's immune systems are the Michael Jordan of immune systems. They never get cold sores. They're the lucky ones. 1 in 20, 1 in 30, they get recurrent cold sores. Their immune system's more like one of those junior high bench basketball players. They're not that great. They aren't good at keeping the virus under control, and it comes back again and again and again. It won't kill you, but it's annoying. Ask anybody that gets cold sores, right? By the way, if you get cold sores, run to your doctor. There is pills, not the stuff you put on a cold sore once it's broken out, too late. You got to catch the guy before he gets in the elevator and comes down. They have some pills. If you take them immediately when you feel that tingling for a cold sore, you can catch it and you can abort a cold sore. But you got to get on it fast. Ask your doctor. They'll tell you about that. That's really true. The cold sore stuff you put on, the lipstick and stuff, chapstick, don't waste your time. Doesn't work. But again, so people that didn't get a good immune response because they didn't take it easy, that Epstein-Barr virus or CMV virus can hang out in your body, in the lymph nodes of your body. We talked about that. And somewhere later, your 30s, your 40s, 50s, it can come back. It can resurge. You won't get the fever. You probably won't get the sore throat. You won't get the abdominal pain, but you'll just be tired. And if they check your blood, maybe your monocytes are a little high, and your body will overcome it again, but it will take time again. And so can mono reactivate? Yes, it's not very common. It's not a very common thing. Everybody thinks it is, but it's not. If you check their blood, it's got some other reason for their fatigue, but it is possible, but it's rare. You're not going to pass it on to somebody. If it resurges, let's say you're 50 and you're working 3 jobs and you didn't sleep a lot, and the monovirus that was already in you from when you were a teenager starts growing again and gets into your system again, you're not going to pass that on to your family or anybody else with your saliva. The second time, it's not going to pass on like that. It's never say never, but it's almost unheard of, or I've never seen it, never heard of it. But I'd never say never, I've learned. But it can reactivate and you can be tired. And who wants that, right? And you go to your doctor and they check the blood and they go, well, your monocytes, maybe a little high, not that much. I don't think it's mono, and nobody's going to believe it. So if you ever get mono as a teenager, or parents or grandparents of teenagers, if they get mono, tell them you're out. You're out of sports because we don't want your spleen to rupture. You're lightening your schedule because you're going to go to bed early, and you make sure they take their vitamins and get good food and eat good meals so they can mount a good immune response. Their Michael Jordan immune response can fight this thing and overcome it so you don't get recurrent symptoms over and over again. That's the ins and outs of mono. That's what it is. It's spread by saliva. You won't die. Sore throat, abdominal pain, aches and pains, and tired. You're exhausted. And all you got to do is rest and you'll get better. Okay, hopefully that helps you, saves you some time and money. If you think you have mono, go to the doctor. They have to do a blood test to determine it for sure, and they'll give you some pointers as well. But that's the long and short of mono. I've seen 1,000 cases of it over the years, or probably more than that. Urgent care in my office and in the ER, you see it all the time. People think it's strep throat, but it's mono. It looks just like it. Anyway, thank you very much for tuning in. Hopefully that helped you, and we'll see you next time. Bye-bye.